Hi everyone, how are you? Hope you will be fine and doing very well. This is Dr. Shabir Khan with Watch and Know Eye Care channel. Today our topic is very good. Today our topic is about treatment of glaucoma. I will tell you about treatment of glaucoma. The damage caused by glaucoma can't be reversed, but treatment and regular checkup can help slow and prevent vision loss, especially if you catch the disease in its early stages. Glaucoma is treated by lowering your eye pressure, intraocular pressure, depending on your situation. Your option may include prescription eye drops, oral medications, laser treatment, surgery, or a combination of any of these. Number one, eye drop. Glaucoma treatment often starts with prescription eye drops. These can help decrease eye pressure by improving how fluid drain flow from your eye or by decreasing the amount of fluid your eye makes, depending on how low your eye pressure needs to be. More than one of the eye drops below may need be prescribed. Prescription eye drop medication include, I will tell you the types of eye drops. These are prostaglandins and beta blockers and alpha adrenergic agonists and carbonic and hydrase inhibitors and nectase or a kinase inhibitor and nectase myotic or cholinergic agents. These are the types of eye drops. By these, eye pressure, intraocular pressure can be controlled or decreased to maintain normal. Because some of the eye drops medicine is absorbed into your bloodstream, you may experience some side effects unrelated to your eyes. To minimize this absorption, close your eyes for 1 to 2 minutes after putting the drops in. You may also press lightly at the corner of your eye near your nose to close the tear duct for 1 or 2 minutes. Wipe off any undue drops from your eyelid. If you have been prescribed multiple eye drops or you need to use artificial tears, space them out so that you are waiting at least 5 minutes in between types of drops. Next is oral medications. If eye drops alone don't bring your eye pressure down to the desired level, your doctor may also prescribe an oral medication, usually a carbonic and hydrase inhibitor. Possible side effects include frequent urination, tingling in the fingers and toes, depression, stomach upset, and kidney stones. Next is the main procedure, surgery and other therapies. Other treatment options include laser therapy and various surgical procedures. The techniques are intending to improve the drainage of fluid within the eye, thereby lowering pressure. These are laser therapy, and next is filtering surgery, and next is drainage tubes, and next is manually invasive glaucoma surgery. After your procedure, you will need to see your doctor for follow up exams and you may eventually need to undergo additional procedures if your eye pressure begins to rise or other changes occur in your eyes. Treating acute angle closure glaucoma, especially I will tell you, acute angle closure glaucoma is a medical emergency. If you are diagnosed with this condition, you will need urgent treatment to reduce the pressure in your eye. This generally will require both medication and laser or other surgical procedures. You may have a procedure called a laser peripheral iridotomy in which doctor creates a small opening in your iris using a laser. This allows fluid, aqueous humor, to flow through it, relieving eye pressures. Viewers, hope this video will be beneficial for you and you will like it. If you like this video, kindly subscribe this channel. See you. Take care.